Hi everyone. If you or someone close to you is living with systemic lupus erythematosus, often just called lupus, you know how relentless it can be. Fatigue, joint pain, skin rashes, flares that come and go, and chronic inflammation can take a serious toll on your life. Today we're talking about a new therapy called Anifrolumab, or Saphnelo. It's the first and only treatment that targets the type 1 interferon pathway, a central part of the immune dysfunction seen in lupus. Saphnelo is a fully human monoclonal antibody that binds to a protein called interferon alpha receptor 1. This blocks type 1 interferons like alpha, beta, and omega from signaling the immune system. That matters because 60 to 80% of people with lupus have an overactive type 1 interferon gene signature. This signature keeps the immune system constantly activated, causing inflammation, joint damage, and skin flares. By blocking this pathway, Saphnelo helps reduce immune system overactivity. Let's talk about the research. Saphnelo was studied in 3 major clinical trials: MUSE, TULIP-1, and TULIP-2. In the Phase 2 MUSE trial, patients with moderate to severe lupus who had a high interferon gene signature showed stronger clinical responses. They used less steroids and had better control over joint and skin symptoms. The Phase 3 TULIP-1 trial didn't meet its primary endpoint based on the SLE responder index, but secondary outcomes showed promise. This set the stage for a better designed follow-up study. In TULIP-2, the pivotal Phase 3 trial, the main endpoint was a BICLA response. At 52 weeks, nearly 48% of patients receiving Saphnelo responded, compared to about 31% on placebo. There were improvements in arthritis, skin rash, and many patients were able to taper steroids. It worked best in people with a high interferon gene signature, though testing for that isn't required. Saphnelo is FDA-approved for adults with moderate to severe systemic lupus erythematosus who are already receiving standard therapies. These include hydroxychloroquine, corticosteroids, and immunosuppressants like methotrexate or azathioprine. It's not currently approved for lupus nephritis or neuropsychiatric lupus. The medication is given as a 300 milligrams intravenous infusion every 4 weeks. It takes about 30 minutes and is done at infusion centers or rheumatology clinics. Most people don't need pre-medication, but doctors may monitor for infusion reactions early on. The most common side effects in trials were upper respiratory infections, cough, bronchitis, headache, and shingles. Because it affects the immune system, there's an increased risk of serious infections. People with a history of shingles might need a zoster vaccine before starting. Serious infusion reactions are rare, but can include flushing, nausea, dizziness, rash, or itching. How does Saphnelo compare to other treatments? Benlysta targets B-cell survival signals and is approved for both lupus and lupus nephritis. Rituximab is used off-label and targets CD20 B cells. Saphnelo targets the interferon pathway, offering a unique approach, especially for skin and joint symptoms. Your doctor may monitor blood work and advise avoiding live vaccines during treatment. It's especially helpful for people who still have flares despite other treatments, or who can't taper off prednisone. Saphnelo represents a more targeted, personalized strategy for managing lupus. It may not be for everyone, but it could be a major step forward for many. Thanks for watching. If you found this helpful, please like, subscribe, and share. And talk with your rheumatologist to see if Saphnelo might be right for you.